we understand you only do 20% of your business with us. Why is that? How can we encourage you to bring more of your business to us? And that sort of confrontational, exposing the data and sort of sales relationship that we were having with them at that time was completely out of my normal scope and approach to anything.
And it sounds like comfort zone too, in terms
Oh,
of like being
completely out of my
confrontational.
comfort zone. Yeah, yeah, and it wasn't really, a confrontation with them. There
Right.
wasn't a lot of disagreement, but it was something that had not been done before. It was data they had not been exposed to before. They didn't know we were aware of it, and it led to some really amazing conversations around what they were looking for.
This is Inspiring Women. Today I'm talking with Rebekah Swain, and we are here in Chicago because Rebekah was just presenting at the SHRM conference. And we're here to talk to Rebekah about several things, including some of the trends that are going on from an HR perspective. What does it mean to have membership engagement from employees, which is really different now, sort of years after the pandemic? Rebekah is a vice president at Advocate Health. She's vice president of managed health strategy, planning, and membership performance. And Rebekah, thank you for being on Inspiring Women.
Thank you so much for having me.
So here you go. You were just telling me your travel schedule, and it sounds like you came here from Raleigh, and now you're here in Chicago, and I think you're
Yeah.
going to 6 different cities,
Well,
after this conference, right?
back and forth a little bit. We're doing, Advocate Health is from Wisconsin to Georgia. So we're
Uh-huh.
spending some time this week in Wisconsin as well.
Okay. So you've been at Advocate now for a year and a half, is that
Yeah,
correct?
just over a year. I joined last April.
Okay. And you've got a long career in the area of managed care, managed health, as well as employee engagement. So give us a little bit of your background, if you wouldn't mind.
Sure. Yeah, I started my career in a hospital system in Raleigh and was there for about 10 years. And we worked in business development, looking at what new services we should have, where they should be placed, what physicians to work with, new equipment, things like that. So we did a lot of connecting with patients, understanding where they wanted care to be delivered.
Mhm.
The area has experienced just tremendous growth over the last 20 years, and figuring out where people were going to be living and working and where they wanted to access that care was really important.
Mhm. For you, Rebecca, in terms of like choosing this career and moving up the leadership
Mm.
ladder and being an executive, now sort of
Mhm.
like for a large population that you're
Mhm.
dealing with, what's kept you interested across the way?
Gosh, my healthcare career started when I was 14.
Oh my gosh.
My mom was a nurse in a hospital on the surgical floor, and for a variety of reasons, I was doing sort of community service hours that you do when you need to in school, and she had me start as a volunteer in the hospital,
Okay.
a real life candy striper with the striped uniform and
Candy
everything.
stripper. Gosh, I haven't heard that
Yeah,
term in a
yeah,
while.
probably they don't call it that these days. But, I worked in the hospital 2 afternoons a week, and the things that I got to see and experience there and the sort of, life or death and dramatic situations and the impact that a community hospital has on the lives of the people in the community is really what drew me to it.
Mhm.
And that continues today, that the things that you're doing have real impact on people's lives.
Yeah, well, healthcare is a special place and it's very personal in terms
Mhm.
of why people stay in it. So if you can you just tell us like what is your job today? What are you
Sure,
responsible for? And what is
sure.
the strategy of Advocate, in terms of how you contribute to that?
Yeah, absolutely. Advocate Health is a large healthcare system now. As I said, we're in 6 states, over 1,000 care delivery sites, 69 hospitals, and 155,000 employees.
Hmm.
And so, in my role, most of the time I spend working through what managed health payers, what contracts we should be sort of running towards, what we might want to be running away from, where should we engage the most, and how we can make the most out of every situation that we're in terms of payer contracts. The membership
And
performance.
are these a payer contract for your team members or are these
No,
payer contracts for people who come to
with
Advocate?
Advocate as a provider.
Okay.
So they, and of course that does include a lot of our teammates, But with Advocate as a provider, we have over 600 managed care contracts with various payers across all those states.
600.
600.
Okay.
And, that
That
does
seems like a lot.
it is a lot, and that happens as a result of the mergers and acquisitions and changes that our system has gone through. But we need to understand where should we be spending our time because
Yep.
we can't just spread it equally across all 600. And so that's really a lot of the analytical work that my team does is to figure out where should we be focusing, where should we be working hardest to engage the members of certain plans. And that's where our membership performance team is engaged in turning members into patients.
Okay.
So when we enter a relationship with either an employer or a payer, the most important first step we can make is get those members to engage in the healthcare system.
Yep.
And so we do that through a variety of efforts, everything from traditional letter writing to messaging to getting in their electronic health portal and messaging them there, emailing them, events on site. We have on site clinics with employers. Different people need different, ways to get engaged. And so we try to offer all of those to get them connected into primary care, whether that's in person primary care or virtual primary care. We get them connected with someone they can trust and build a relationship with and see for all their healthcare needs.
Rebecca, you're talking about a couple things in healthcare that sound I've been in healthcare a long time. You've been in healthcare a long time, and it's only become more complicated. We're doing this conversation together. We've got Transcarent in the background, a one place
Mhm.
for health and care. The systems become more complicated. So if you think about the trust that you're trying to achieve with your members, turning them into patients across 600 contracts across a large scale health system, how are you making things more simple? How are you actually achieving
Mhm.
that engagement, that trust that you're trying to do at Advocate?
Yeah. I don't know if we're making it more simple, but I think on a single member basis, we're trying to make it easier, like you
Okay.
said, to get connected. And you asked about our mission. We have a mission around improving health and elevating hope, advancing healing for all. And that for all, a lot of times I think gets interpreted as meaning people who need financial assistance, who need charity care, but it's not just that. If you think about a working mom who has a couple of kids and I remember what it's like. It's all you can do to deal with the emails from school and the pick up and drop off from daycare. You don't really have time as a mom to take care of yourself.
Right.
And, connecting with that mom might mean engaging her in virtual primary care that she can have an appointment at 11 o'clock at night from
Yep.
home and have that relationship with a primary care provider that way. So we try to create those approaches that make it simpler for an individual person because healthcare is so personal and let them make decisions about how and where and when they receive that care instead of having, sort of a single office or a single location and everyone has to come to us.
Well, what do you think then in terms of just, I mean, we've seen so much adoption of whether it's, digital health solutions,
Mhm.
telehealth, and things like that. And people do expect access, 24/7 these days. So how are you achieving that at Advocate? So like, what do you think that you are doing that is special so that you really can engage those members?
Yeah, I'm really excited about our virtual programs. We have everything from full virtual primary care practices, not just when I'm sick and need an antibiotic, but permanent relationships with a virtual primary care provider. We have a thriving hospital at home program that was born out of some CMS waiver work that was done during COVID, but is still thriving today. Where we take care of inpatients in their homes using remote patient
Oh,
monitoring
really?
so that they can stay in the comfort of their home. They have caregivers around them if they have family at home. That family doesn't have to worry about transportation back and forth to a hospital. And they can stay in that familiar environment. People like that obviously have to be clinically appropriate for that kind of care, but they have the remote monitoring and they have the in-person visits when they need them.
Yep.
So thriving hospital at home program, a lot of virtual consults. A lot of our territory is quite rural, and being able to have the top experts from our urban center hospitals do consults with their care providers out in their rural communities and the smaller hospitals brings that top notch care to their region and to their home, which is really exciting that they don't have to travel hours and hours to get to that tertiary center.
I agree. I mean, look, I think, any person expects that when they are receiving care from a physician, that it should be a certain level of quality. But as you know, there is a lot of variety for all kinds of different factors, that are out there. So the access to, the top physicians to
Mhm,
get the best level of care, regardless of where you are,
mhm,
that's exceptional. And that,
mhm,
and complicated, right? In
mhm,
terms of actually being able
mhm,
to provide it. So with Transparent,
mhm,
that Transparent provides a lot of solutions to organizations, to employers,
mhm.
and employers are becoming harder and harder to reach in terms of
Yeah.
how you interact with them. So I'd love your thoughts in terms of what kinds of solutions when, how
Mhm,
do you engage large employers? Because
mhm.
people go where they can get the highest quality of care, but it has to be affordable too.
Well, and it's hard to know what is highest quality. What is
Yep.
highest quality to me may not be highest quality to you. There's a lot of there's just a ton of information out there, and I think the reason we partnered with Transparent to be a site of care, a destination site of care in their network, was because they cut through that. Help make it simple
Hmm.
for an employee when they're in that time of crisis, needing a particular type of care or surgery, whatever it may be, to help guide them and to walk that path with them and deliver them to a place like Advocate where they can get that care that they need, and be confident that they're receiving it, like you said, at the highest quality, but also affordable.
Right, and whenever they need to, because healthcare and issues don't wait for
Mhm.
a certain time of day, no
And they
matter
don't
what.
wait for research, right? I
Right,
mean, the last thing you want to be doing in that time of need is starting your own research project to try
right.
to determine where you should go. And so I think having that trusted source is really appealing to employers too.
Yep, yep. So Rebecca, you were at this conference that you
Mhm,
came to Chicago to
mhm,
actually speak at. You were talking about innovation in healthcare. You were
mhm,
talking about, sort of like where is the future in terms of engaging
mhm.
members and stuff. So I'd love to get your comments and thoughts on that.
Yeah, we had some good conversations around that lately, and the workforce is more diverse, I think, than ever before. And we're celebrating that diversity and celebrating that individual needs and wants more than ever. And that bleeds over into how they want to receive their health care. And I think being able to have a variety of models is fantastic because then you can engage with people on their own terms, wherever they're at. Um, but along with that comes complexity, right? The
Hmm.
more different models that you have, it's harder for people to understand where to go, what they should be doing. And so having some trusted source, whether it be Transparent or some other program that their employer or that their provider has, to get that engagement and that direction to where they want to go, I think that just gets more important because there's more options than ever, and it's harder to know who to trust.
Yep. Yep. So in terms of that future state, okay, so like if we think about what is in terms of, your any person at your employer, you're trying to figure out where to get care, you often turn to whatever app they have made available for
Mhm,
you. You're trying to get some simplicity around
mhm,
that. What do you think is the difference between sort of like where the confusing state of today is to what might be optimal, in terms of
mhm,
where you would want your members, your people who are coming to Advocate to have available. If you were to wave your magic wand and paint the
mhm.
future state for all of us, what would that look like?
The hot topic obviously is AI for everyone these days. And the beauty of AI is the ability to take huge quantities of data and sift through it, sort through it, make the connections and the inferences faster than a human can. And we have some great examples of how AI is serving as a decision support tool
Yep.
to our clinicians, especially in emergency situations. We have an ED program around stroke detection and identification, and rapidity is really essential when you're dealing with stroke. But if you take that same AI model of sifting through tons of data and being able to get inferences and conclusions, it's a great use case for things like finding care
Yep.
and understanding the quality of care and where I should go. What's my next next best action.
Mhm.
And I think there's a lot of applications for it there.
Yep, and we, certainly at Transparent, we're talking a lot about this in the sense of, we're calling it wayfinding and really trying to find
Mhm.
that navigation to what is the appropriate care that I need. So something as simple as my shoulder hurts, where do I go for it? That should
Mhm.
be a simple use case for
Mhm.
AI to solve for, yet it can be so very complicated unless you can actually
Mhm.
apply some tools to do that.
Yeah, absolutely. And I think having a primary care point of connection is really important. And certainly there's always going to be times when you're going to want to talk to your personal physician about what the next best course of action may be. But all of the administrative steps that are included in that, checking if a doctor's in your network, making sure you've got benefit coverage for it, whatever those things may be, getting decision support tools in place, whether for the provider or for the consumer to make that decision better and sort of come out with an optimal decision sooner, I think is the future.
Yep, and hopefully the future is now and happening sooner. Rebecca, I want to go back to on inspiring women. I love to showcase women leaders like yourself, and particularly in the area of healthcare, because we make 80% of the decisions for our families, our
Yeah.
parents, our children, our extended families. And when we're in the space of healthcare, even though we know how complex it is, other people, friends and family come to us. So as you think about your role, not just as a woman making healthcare decisions, but also as a leader in the healthcare space, how do you see sort of like for women who are leaders, how do you see us making further impact in the years ahead?
Oh gosh, impact
That's
everywhere.
a big
It's a big
question.
question. It's a big question. I think it's important for women to get involved in all of those places. And certainly women have historically played a really important role in healthcare, whether it be traditional caregiver roles within the family or as nurses, and now as leaders in the healthcare system. There's room at the table there for expansion of that, and I think that women at the table will help to make those decisions better
Mhm.
and help us to advance the ball, right, in making sure that we're delivering care to all the people that need it.
Yep. And Rebecca, as we were talking about earlier, I certainly believe that more women around the leadership table make for better business decisions, make for more equitable decisions for the people that we're actually serving. If you can go back into those times of, starting out as a candy striper, now being the leader that you are today, and just think of the next generation of
Mhm.
women leaders who want to be like Rebecca Swain, what advice would you be giving them?
Oh gosh, I think that the biggest thing would be to work in different parts of the healthcare sector, whether that be for a healthcare provider, in a hospital, in a health insurance plan, in a solutions provider. I think that getting different perspectives on the same issues is really important as you're building your career early on. And I would say embrace the difficult assignments. That we've all had assignments when we were younger and today that we, maybe saw as more challenging or uncomfortable. And those are typically the ones you just learn so much from.
Can you point to one that, that you took on that maybe was sort of like that assignment you didn't want, but you took it anyway that was really important to you?
In my first role in a hospital organization, we did business development. And one of the things we did was dig into we had a data set that we had available to us that had never really been used very much. And we were able to dig into it and start to analyze physician practice patterns, sort of what kinds of cases they took to which facilities and how much of their business they did with our hospital versus a competing hospital, and dig into the why of that. And it led to some interesting conversations with those physician leaders who very often were men and well-established physicians in their fields. And we would sit and have conversations with them about, we understand you only do 20% of your business with us. Why is that? How can we encourage you to bring more of your business to us? And that sort of confrontational exposing the data and sort of sales relationship that we were having with them at that time was completely out of my normal scope and approach to anything.
And it sounds like comfort zone too, in terms
Oh,
of like being
completely out of my
confrontational.
comfort zone. Yeah, yeah, and it wasn't really, a confrontation with them. There
Right.
wasn't a lot of disagreement, but it was something that had not been done before. It was data they had not been exposed to before. They didn't know we were aware of it, and it led to some really amazing conversations around what they were looking for.
How did you handle that? So, sometimes when you are sort of like the earlier stage of your
Mhm,
professional self and you're going into one of those conversations and it's like there's
mhm,
somebody who is much more senior that you're
mhm,
presenting to, and it's not necessarily, the best news or something like that. I mean,
mhm.
that's can be a little bit frightening. So how did you handle yourself in that
Yeah.
moment?
There's a couple of things, I had a lot of good mentors, men and women, who I copied, right?
Uh-huh.
I saw their style. I appreciated how they handled themselves in moments like that. And I said, just do what they would do and go through it. And I think there's a fair bit of fake it till you make it
Uh-huh.
involved there that you just carry through and get through it. And then I think the biggest thing is admit that you're uncomfortable and inexperienced
Mhm.
and that you don't have the answers and that you're there on a fact-finding mission. I have this data. I want to talk to you about it. I'd like to understand.
Uh-huh.
I'm looking to get knowledge from you. And most of them were great about explaining why they had certain things, locations they wished we had, equipment they wished we had. It led to so many great business development opportunities for our organization. It was absolutely worth it.
Wow. And it also sounds like, just the approach that you showed up with in terms of just being, self aware and also making it sort of your uneasiness comfortable for everyone and then really showing what you were capable of. That's really impressive. This has been a fantastic, inspiring women conversation. Really thankful that you were able to be here today, Rebecca. Rebecca,
Thank
thank you
you. Thank
so
you.
much.
I appreciate it.
This has been an episode of Inspiring Women with Lori McGraw. Please subscribe, rate, and review. We are produced at Executive Podcast Solutions. More episodes can be found on inspiringwomen.show. I am Lori McGraw, and thank you for listening.